John, Morgan Beatty is from right here in Portland and spent most of her life caring for animals as a veterinarian technician. When the pandemic hit, her son was diagnosed with type 1 diabetes. That inspired her to shift her own career into healthcare. But she wouldn't have been able to make that big career jump without Concordia University St. Paul. Many healthcare workers left the field during or after the 2020 pandemic. The stress of the worldwide health crisis pushed many to rethink their careers. All Morgan Beatty saw was opportunity.
So I actually used all of my economic stimulus money to go back to school to become a nurse.
Her son had been diagnosed with type 1 diabetes, and as a veterinarian technician, she already had a love for caregiving.
So I spent a long time in the pediatric ICU with him and just watching how the nurses were working together and care for him.
Fast forward to today, Morgan is 1 week from becoming one of those nurses she once admired, thanks to Concordia University St. Paul having an accelerated 16-month nursing program. According to the American Association of Colleges of Nursing, despite the demand, traditional colleges and universities lack the faculty, clinical sites, and clinical programs to serve the number of students interested, turning away over 65,000 qualified applicants in just 2023. Dr. Kate Whalen, director of the Concordia St. Paul program, tells us Oregon produces the third fewest nursing graduates per capita in the U.S. The program she leads is dedicated to fixing that issue.
That's why we are trying to give students access to education and let them come in and become the nurses that they really want to be.
For Morgan Beatty, soon to be a full-fledged nurse, being a part of the Concordia program opens doors to a brighter future.
I realized that I wanted to be a part of something bigger and something more important.